also says that some of the things we want to do, for example, to increase health care, don't make sense when we can do it a better way and we can do it a lot cheaper and immediately. For example, one of the debates I have with two of my colleagues I greatly respect, they're both really fine people, is Medicare for all. Well, that's a great idea, but guess what? It costs minimum $3.4 trillion per year. That's twice the entire national budget, except for interest on the debt. Now tell me, especially if we're in a recession, we're going to raise your tax as a middle-income person, as Bernie acknowledges, he's honest about it, 5% and 4% in terms of your deductible, as well as 4 to 5% on your income tax. I don't think you can sustain that at a time now, and you still only cut half of it. So, for example, we got to be smarter in what we do to get to where we need to get. I take Obamacare and I reestablish all that was cut from it, making sure we keep all pre-existing and all the things that are in there now, and I add a public option to it. And I allow you to keep your private health insurance if you negotiated hard with a company over the years and you have a private plan you like. As long as you have it, you can keep it. But if you don't like it or it's cut, you can immediately join this new plan, which is an amped up Obamacare, where we subsidize more significantly being able to get into a gold program, so you never have to have more than a $1,000 deductible. Now, my plan costs a lot of money. It costs $740 billion over 10 years. It does not cost $30 to $40 trillion over the next 10 years. And I think it works better, by the way. There's no, as my mom would say, you don't miss anything between the cup and the lip. You know, nothing gets lost. You know, pardon me?
There's still profits in healthcare then. Insurance
Sure, there's profits in healthcare. I tell you what, but everybody gets healthcare, and you only have a few people. But are you prepared to pay 9% more to your taxes?
You bet.
All
I
right.
don't even have the kind of health insurance that some companies cover.
Well, okay.
People need to have insurance. We need to have a leader that isn't protecting insurance companies' profits.
I am not protecting insurance. That's unfair to say. Insurance. No, whoa, hang on a second.
That's private insurance.
Wait a second. No, it's not. Here's the deal. The insurance companies are strongly against my plan. They were against Obamacare. They're fighting against it because they know it costs them. But here's the deal. If you have worked your whole life, you've given up 5, 7, 8% of your salary to get coverage with a plan that you may have with your employer, and now what's going to happen? If you are no longer able to keep it, what happens? The employer gets a multi-billion-dollar breaks across the board, and you think they're going to give it back to you? Number one. Number two.
Give it to the government so we can pay for that insurance.
Well, they're not going to give it to the government.
We're going to make them do it.
Well, God love you. You got the right candidate in Bernie. You got the right one. Well, and Elizabeth, or whomever you have, that's a great thing. But here's the point, folks. We have to be able to level with you and tell you the only way the single biggest issue is health care in this election in people's minds. You can't beat Trump by not being straightforward.
That's right.
About what it's going to do. You just got to level. And so if you're willing to pay, and I respect you, if you're willing to pay the extra taxes and you think you get much more for that, then that's good. That's good. But let's at least acknowledge, tell Elizabeth it's going to cost a lot of money. And she's going to raise people's taxes doing it. And what are we going to do in the middle of a recession if we end up there? Okay, anyway.
Thank you, Vice President Biden. I'm going to try to get 2 quick questions in. If we can get